Traditional Chinese medicine, often abbreviated as TCM, is a comprehensive healthcare system that originated in ancient China. TCM is based on over 2,500 years of medical practice and philosophical understanding of the human body. Central to TCM is the view that health represents a state of balance and harmony within the body. Illness is understood as a disruption of this balance. TCM practitioners use various diagnostic methods to identify these imbalances. TCM has a unique understanding of the body's systems, including energy pathways called meridians that connect different parts of the body. TCM employs various treatment approaches, with herbal medicine being one of its most recognized components. Traditional Chinese medicine represents a holistic approach to health that has been practiced and refined over thousands of years. This holistic healthcare system continues to be practiced today, both in its traditional form and in integration with modern medicine. Traditional Chinese medicine views the human body as an integrated whole, where physical, mental, and spiritual aspects are inseparable. This interconnectedness means that the mind, body, spirit, and soul all affect one another, and treating one aspect influences the others. TCM is founded on three key holistic principles. First, the body, mind, and spirit are interconnected. Second, humans are integrally connected with nature and the environment. Third, all internal organ systems are interrelated and function together. The five elements theory illustrates these interconnections, showing how different organs, emotions, and natural elements support and control each other in a balanced system. Balance is fundamental to health in traditional Chinese medicine. It focuses on maintaining equilibrium within the body and between the body and its external environment. This includes the internal balance of yin and yang, proper qi flow through meridians, harmony between organ systems, and the body's ability to adapt to environmental changes. The meridian system illustrates how qi flows through specific pathways in the body. When this flow is balanced, health is maintained. Blockages or imbalances in this system can lead to illness. TCM also recognizes the connection between humans and the five elements of nature: fire, earth, metal, water, and wood. These elements correspond to different organs and emotions, creating a comprehensive framework for understanding health and disease. The holistic and balanced approach of TCM offers several benefits. It helps prevent disease before it manifests, enhances overall well-being, improves resilience to stressors, and allows for personalized treatment based on individual constitution and needs. These core principles of holism and balance form the foundation of traditional Chinese medicine's approach to health and healing. Yin and yang are fundamental concepts in traditional Chinese medicine. They represent opposing yet complementary forces that exist in all things in the universe. The yin-yang symbol illustrates this duality, with black representing yin and white representing yang. Yin is associated with coolness, passivity, internal aspects of the body, rest, and darkness. Yang, on the other hand, represents warmth, activity, external aspects, movement, and light. In TCM, yin and yang are used to classify different aspects of the body. The upper body is yang, while the lower body is yin. External body parts are yang, while internal organs are yin. Yin and yang also interact with the five elements theory in TCM, creating a complex system of relationships that explains how different aspects of the body and nature influence each other. In traditional Chinese medicine, health is maintained when yin and yang are in balance. When this balance is disrupted, disease can develop. An excess of either yin or yang, or a deficiency in one relative to the other, can manifest as various symptoms and conditions. TCM therapies such as acupuncture, herbal medicine, and dietary recommendations aim to restore the proper balance between yin and yang in the body. Understanding the concept of yin and yang is essential for TCM diagnosis and treatment. It provides the theoretical foundation for all other aspects of traditional Chinese medicine. The five elements theory is a fundamental concept in traditional Chinese medicine, describing the cyclical relationships between wood, fire, earth, metal, and water. Wood. associated with growth, flexibility, and the liver and gallbladder. Fire represents warmth, transformation, and the heart and small intestine. Earth symbolizes stability, nourishment, and the spleen and stomach. Metal relates to structure, boundaries, and the lungs and large intestine. Water embodies flowing, conserving, and the kidneys and bladder. Each element corresponds to specific organs, emotions, seasons, and other aspects of both the body and nature. This table shows the main correspondences for each element in traditional Chinese medicine. The five elements interact in generation and control cycles. In the generation cycle, each element nurtures the next, while in the control cycle, each element restrains another to maintain balance. The generation cycle shows how each element nourishes the next, while the control cycle demonstrates how balance is maintained through mutual restraint. In clinical practice, TCM practitioners use the five elements theory to diagnose patterns of disharmony and develop treatment strategies that restore balance to the body's interconnected systems. The five elements theory provides a framework for understanding the complex interrelationships within the body and between the body and its environment. Meridians are a network of energy channels that transport qi and blood throughout the body. These pathways are invisible to the naked eye, but they form a complex system that connects every part of the body. These channels connect different organs and tissues, maintaining conductivity throughout the body and helping to resist external pathogens. There are 12 principal meridians corresponding to the 12 Zangfu organs and 8 extraordinary meridians in the body. Each meridian is most active during a specific 2-hour period of the day. Each meridian follows a specific pathway through the body, connecting surface points to internal organs. These pathways form a comprehensive network throughout the entire body. Acupuncture points are specific locations along these meridians. Stimulating these points with needles or pressure can help regulate the flow of qi and restore balance in the body. When meridians become blocked, illness can develop. Understanding that qi follows daily cycles through different meridians is crucial in traditional Chinese medicine. These pathways serve as the vital connection between the body's interior and exterior. The meridian system forms the foundation for many TCM therapies, particularly acupuncture, and is essential for maintaining health and harmony in the body. Pattern differentiation is a fundamental diagnostic approach in traditional Chinese medicine. It involves identifying specific patterns of disharmony that are causing a patient's symptoms. TCM practitioners use 4 diagnostic methods to gather information about the patient's condition. These methods include looking, which involves observing the patient's appearance, especially the tongue, listening to the patient's voice and breathing, asking about symptoms and medical history, and touching, particularly feeling the pulse. The 8 Principles framework is one of the most important tools for pattern differentiation. It categorizes conditions into 4 pairs of opposing qualities: yin and yang, interior and exterior, deficiency and excess, and cold and heat. Tongue diagnosis is a critical component of pattern differentiation. Different areas of the tongue correspond to different organs, and changes in color, coating, and shape reveal important diagnostic information. The relationships between Zangfu organs are also considered when identifying patterns. These relationships follow the 5-element theory, where organs mutually support or control each other. Let's look at an example of pattern differentiation in chronic obstructive pulmonary disease. TCM recognizes different types of deficiencies that can occur during the stable stage of COPD, each with specific symptoms and treatment approaches. Accurate pattern differentiation requires a comprehensive assessment of the patient's signs and symptoms, examination of the tongue, pulse, voice, and complexion, analysis of medical history and lifestyle, and forms the foundation for determining appropriate treatment. Acupuncture is one of the most recognized therapies in traditional Chinese medicine. Acupuncture involves inserting thin needles into specific points on the body to stimulate qi flow and restore balance to promote healing. Acupuncture points are located along meridians, which are pathways through which qi flows. The body has 12 principal meridians and 8 extraordinary vessels. There are over 350 acupuncture points on the human body. Each point has specific therapeutic effects and is selected based on the patient's condition. During an acupuncture session, sterile hair-thin needles are inserted into specific points. The needles typically remain in place for 15 to 30 minutes. Patients may feel mild sensations such as tingling or warmth. Multiple sessions are usually recommended for optimal results. Acupuncture has been clinically shown to be effective for a wide range of conditions. These include pain management, such as chronic back pain and migraines, neurological conditions like stress and anxiety, women's health issues including infertility, and digestive problems such as nausea and irritable bowel syndrome. Modern scientific research has validated acupuncture's effectiveness. Studies show that acupuncture stimulates the nervous system and releases endorphins, activates the body's natural healing mechanisms, increases blood flow to tissues, and modulates the immune system. Both the World Health Organization and National Institutes of Health recognize acupuncture as effective for specific conditions. Acupuncture continues to bridge ancient wisdom and modern medicine, offering a powerful approach to healing and wellness. Herbal medicine is a cornerstone of traditional Chinese medicine, utilizing the natural healing properties of plants. Traditional Chinese herbal medicine uses combinations of natural ingredients derived from plants, minerals, and sometimes animal sources. This practice is based on thousands of years of observation and clinical experience. Chinese herbal formulas follow a sophisticated design principle. Each formula typically contains a chief herb that addresses the main pattern of disharmony, supported by deputy herbs that enhance its effect. Assistant herbs treat secondary symptoms, while envoy herbs guide the formula to specific parts of the body. Unlike Western approaches that might target specific symptoms, Chinese herbal medicine addresses the root patterns of disharmony in the body. These patterns, such as qi stagnation, blood deficiency, or yin-yang imbalance, are identified through careful diagnosis and then treated with specific herbal combinations. Chinese herbs can be prepared in various forms. Traditional decoctions involve simmering raw herbs in water. Modern preparations include convenient granules, pills, tablets, and tinctures. The form chosen depends on the condition being treated and the patient's preferences. While herbal medicine can be highly effective, safety concerns exist. There have been increased reports of adverse reactions from Chinese herbal medicine. Potential issues include herb-drug interactions, quality control problems, and improper usage. Some herbs contain compounds that can be toxic if not properly prepared or dosed. Due to these potential risks, it's essential to consult with properly trained herbal medicine practitioners. They possess the knowledge to correctly diagnose conditions, identify herbs accurately, determine appropriate dosages, monitor for side effects, and understand contraindications. Never self-prescribe Chinese herbs, especially for extended periods of time. Tui Na is an ancient form of therapeutic massage in traditional Chinese medicine. The term Tui Na translates as push and grasp, reflecting the fundamental techniques used in this therapeutic practice. It combines pressure and manipulation to stimulate the flow of qi through the body's meridians. Tui Na practitioners employ several key techniques, including separate pushing, rotating push, palm pressing, and finger pressing. Each technique serves specific therapeutic purposes and targets different areas of the body. These specialized hand techniques work to release muscle tension, improve circulation, and restore balance to the body's energy systems. Like acupuncture, Tui Na is based on the meridian system of the body. Practitioners target specific meridians and acupressure points to address blockages and imbalances in the body's energy pathways. Tui Na is particularly effective for treating musculoskeletal conditions such as back pain, neck pain, and sports injuries. It's also beneficial for headaches, digestive disorders, and stress-related conditions. The benefits of Tui Na include relief from pain and muscle tension, improved circulation of qi and blood, reduced stress, enhanced immune function, and increased joint mobility and flexibility. Unlike Western massage that focuses primarily on muscles, Tui Na works with both the physical body and energy system, making it a comprehensive therapeutic approach in traditional Chinese medicine. Moxibustion is a traditional therapeutic technique that uses the burning of mugwort to warm the meridians. This healing practice involves burning dried mugwort, scientifically known as Artemisia vulgaris, near specific points on the skin to stimulate qi flow through the meridians. Mugwort is a medicinal herb with a long history in traditional Chinese medicine. It contains essential oils and flavonoids that give it warming properties, making it ideal for dispelling cold and dampness from the body. There are several methods of applying moxibustion. The three main types are direct moxibustion, indirect moxibustion, and warm needle moxibustion. Moxibustion works by targeting specific acupoints along the body's meridian system. The heat penetrates deeply to stimulate qi and blood flow, removing blockages and balancing energy through these channels. Moxibustion is particularly effective for treating conditions characterized by coldness or stagnation. These include chronic pain conditions like arthritis, menstrual cramps, digestive disorders, and conditions related to yang deficiency. The therapeutic effects of moxibustion occur through thermal stimulation of acupoints, increased blood circulation, and the release of anti-inflammatory compounds. This activates sensory receptors in the skin and helps regulate the autonomic nervous system. Cupping, creating suction for healing. Cupping therapy is an ancient healing technique that uses special cups to create suction on the skin. This traditional practice has been used in China and across the world for thousands of years. Cupping works by creating negative pressure on the skin. This draws blood to the surface, increases circulation, and helps relieve muscle tension and pain. The suction effect can reach deep tissue layers, promoting healing and toxin release. Various types of equipment are used in cupping therapy. Traditional practitioners often use glass cups, while modern sets may include plastic or silicone cups with suction pumps. The type of cup used depends on the treatment area and specific technique. There are several types of cupping therapy. Dry cupping is the most common and simply uses suction. Wet cupping involves making small incisions in the skin before applying the cups. Moving cupping involves sliding the cups across oiled skin. And flash cupping is quickly applied and removed for stimulation. Cupping often leaves circular marks on the skin that range from light pink to dark purple. The darkness of the mark typically indicates the level of stagnation in that area. In traditional Chinese medicine, these marks and their locations can provide insight into organ functions and energy imbalances. Specific points on the body are targeted based on the condition being treated. Cupping is commonly used for pain relief, respiratory issues like asthma and colds, digestive disorders, and headaches. The location of the cups corresponds to meridian lines and acupuncture points in traditional Chinese medicine. During a typical cupping session, the patient lies comfortably while the practitioner applies oil to the skin if needed. The cup is placed on the treatment area, and suction is created either using a pump or the traditional fire method. The cups remain in place for 5 to 15 minutes before being gently removed. Traditional Chinese medicine views lifestyle as fundamental to health and harmony. TCM identifies several key lifestyle factors that promote balance in the body and mind. Regular sleep is considered essential for health in TCM. The hours between 11 p.m. and 3 a.m. are particularly important for liver and gallbladder restoration. In TCM, emotions are directly linked to physical health through the 5 elements theory. Each emotion corresponds to specific organs and systems in the body. TCM offers practical self-care techniques like acupressure that can be applied daily to address common issues and maintain health. TCM practitioners provide personalized lifestyle recommendations based on your unique constitution, often determined through methods like pulse diagnosis. Traditional Chinese medicine continues to gain worldwide recognition and popularity. TCM's popularity is growing globally, especially for managing chronic conditions like pain, stress, and digestive disorders. This growth is partly due to increasing recognition of TCM's effectiveness and safety when administered by properly trained practitioners. There's a growing interest in natural and holistic approaches to healthcare, focusing on treating the whole person rather than just symptoms. The traditional Chinese medicine market is experiencing significant growth. Projections show it will reach $124.64 billion by 2030. This represents a compound annual growth rate of 7.59% from 2025 to 2030. This growth trend illustrates the steady increase in global adoption and market expansion. TCM is increasingly being adopted in various regions worldwide, including North America, Europe, Australia, and throughout Asia. As awareness grows, traditional Chinese medicine continues to establish itself as a complementary approach to healthcare worldwide. In traditional Chinese medicine, disease prevention plays a fundamental role. A significant portion of traditional Chinese medicine focuses on preventing illness before it develops. TCM emphasizes the importance of maintaining balance and harmony in the body. This approach views disease as a result of disharmony that can be prevented. Traditional Chinese medicine recommends several key preventive practices to maintain health and prevent illness. Managing stress is a critical component of disease prevention in TCM. With approximately 55% of Americans experiencing stress daily, TCM offers valuable solutions through herbs and practices. Dietary therapy is fundamental to TCM prevention. Foods are classified according to their properties and effects on the body, with diets tailored to individual needs and seasonal changes. Adequate sleep is considered essential for disease prevention in TCM. Sleep allows organs to regenerate, and TCM offers various techniques like herbs, acupressure, and qigong to improve sleep quality. In traditional Chinese medicine, prevention is considered superior to treatment. This philosophy emphasizes maintaining balance through a personalized, holistic approach that integrates diet, sleep, exercise, and stress management. By following these preventive practices, TCM aims to maintain health and prevent illness before it manifests. Traditional Chinese medicine has played a significant role in addressing COVID-19 symptoms and supporting recovery. During the pandemic, TCM has been widely used in China and other countries as a complementary approach for treating COVID-19. Traditional herbal formulations have been shown to relieve symptoms, reduce progression to severe disease, and improve overall recovery. In traditional Chinese medicine, COVID-19 is viewed as a condition affecting the respiratory system, particularly the lungs and kidneys. TCM treatments aim to clear pathogens, restore balance, and strengthen the body's natural defenses. Modern TCM laboratories prepare carefully formulated herbal combinations based on these principles. Research teams analyze traditional formulas used for similar respiratory conditions throughout history. The World Health Organization assembled expert panels to evaluate TCM's potential in treating COVID-19, encouraging rigorous studies while emphasizing integration with conventional treatments. One of the most widely used TCM formulations during the pandemic has been Lianhua Qingwen. This traditional formula contains multiple herbs, including forsythia and honeysuckle. Clinical studies suggest it helps relieve symptoms like fever, cough, and fatigue, and it was included in China's official COVID-19 treatment protocols. Traditional Chinese medicine offers promising alternatives for treating infertility. Recent meta-analyses suggest that traditional Chinese medicine approaches may be more effective than conventional Western medicine treatments like IVF for certain infertility cases. These studies compare success rates across different age groups and treatment protocols. Traditional Chinese medicine approaches to infertility typically involve a holistic combination of treatments, targeting the body's natural balance and energy flow. Acupuncture is a key component of TCM fertility treatment. It involves placing thin needles at specific points along the body's meridians. These acupuncture points are believed to stimulate blood flow to the reproductive organs, regulate hormonal balance, reduce stress, and may improve outcomes when used alongside Western fertility treatments like IVF. Chinese herbal medicine offers another approach to fertility treatment. Practitioners create custom formulations based on individual diagnoses of imbalances. These formulas are designed to address specific fertility issues, balance hormones naturally, and may improve the quality of eggs and sperm. Each prescription is tailored to the unique needs of the patient. Increasingly, fertility specialists around the world are recognizing the potential benefits of combining traditional Chinese approaches with conventional treatments for optimal results. Beyond acupuncture and herbs, TCM fertility treatment includes comprehensive lifestyle recommendations. These include dietary adjustments to support reproductive health, stress reduction techniques, appropriate exercise, sleep regulation, and avoiding substances that may reduce fertility. These recommendations are customized based on each individual's constitution and specific fertility challenges. Traditional Chinese medicine offers a holistic alternative or complement to conventional fertility treatments. It addresses root causes of infertility, treats the whole person rather than just symptoms, may be effective when conventional treatments have failed, and can work alongside Western medical approaches for comprehensive care. Traditional Chinese medicine offers valuable support for cancer patients undergoing conventional treatments. TCM is used as a complementary approach alongside conventional treatments like surgery, chemotherapy, and radiation. While conventional treatments target the cancer directly, TCM therapies focus on managing side effects and supporting overall well-being. TCM offers effective strategies for managing common side effects of cancer treatment. Fatigue, one of the most common complaints, can be addressed with acupuncture and herbs that boost qi energy. Nausea and vomiting often respond to acupressure at specific points and simple remedies like ginger tea. Pain management is achieved through acupuncture and therapeutic massage to release tension and promote circulation. Immune system support is crucial during cancer treatment, with herbs like astragalus and medicinal mushrooms showing promising results. By addressing these side effects, TCM significantly improves cancer patients' quality of life during treatment. Studies show improvements in multiple dimensions of well-being, including reduced side effects, better sleep, emotional balance, improved appetite, and increased energy levels. Growing research supports the efficacy of TCM in cancer care. Clinical studies show acupuncture can reduce chemotherapy-induced nausea by up to 70%. Certain herbal formulas may help protect bone marrow during chemotherapy, reducing the severity of blood count drops. TCM approaches can help maintain white blood cell counts when used alongside conventional treatment. Patients consistently report improved emotional well-being and reduced anxiety with integrated care approaches. While beneficial, there are important considerations when incorporating TCM into cancer care. Always inform your oncologist about any TCM therapies you're using. Work with TCM practitioners who have experience in cancer care. Be aware that some herbs may interact with chemotherapy drugs. Remember that TCM complements but does not replace conventional cancer treatment. Seeking treatment from qualified and experienced TCM practitioners is crucial for effective and safe care. Traditional Chinese medicine encompasses many complex diagnostic methods and treatments that require specialized knowledge and extensive training. Untrained practitioners pose significant risks, including misdiagnosis, incorrect herbal prescriptions that may be harmful, unsafe acupuncture techniques, and dangerous herb-drug interactions. A qualified TCM practitioner must have formal education in TCM theory, extensive clinical training, comprehensive knowledge of herbal medicines, a deep understanding of body systems, and mastery of diagnostic techniques. In many countries, TCM practitioners must obtain formal licensing and certification. This typically requires graduation from an accredited TCM program, passing national board examinations, obtaining proper licensing, and completing continuing education courses. When choosing a TCM practitioner, it's important to verify their credentials and licensing, check their education and training background, assess their clinical experience, look for professional association membership, and evaluate their communication style. Remember, when it comes to your health, seeking care from properly trained TCM practitioners ensures both safety and effectiveness. Expert opinions on traditional Chinese medicine vary widely across the medical community. There's increasing acceptance and integration of TCM practices, particularly acupuncture, into mainstream healthcare settings. However, many medical experts remain skeptical of TCM due to its perceived incompatibility with modern scientific principles. A balanced perspective recognizes both the potential benefits and limitations of TCM. Traditional practitioners emphasize the importance of individualized care and centuries of clinical observation. Making informed decisions about TCM requires understanding both the traditional wisdom it offers and the concerns raised by modern scientific inquiry. Traditional Chinese medicine is entering a new era of modernization and innovation, blending ancient wisdom with cutting-edge technology. TCM practices are evolving through standardization and scientific validation. Traditional herbal formulations are being rigorously tested using modern scientific methods while preserving their holistic principles. Artificial intelligence and machine learning are being integrated to enhance TCM diagnosis and treatment. These technologies help analyze complex pattern recognition systems that are central to TCM practice. Advances in bioinformatics and computer-aided drug design are helping researchers identify active compounds in traditional herbs and understand their mechanisms of action at the molecular level. The increased popularity of digital platforms has made global communication and education about TCM more accessible than ever before. International training programs are helping expand TCM's reach while ensuring proper practice standards. As traditional Chinese medicine continues to embrace modern innovations while preserving its core principles, it is poised to make significant contributions to global healthcare in the coming decades. As we conclude our exploration of traditional Chinese medicine, let's reflect on its valuable contributions to healthcare. Traditional Chinese medicine offers a unique approach to healthcare that emphasizes holism, seeing the body as an interconnected system rather than isolated parts. At its core, TCM focuses on maintaining balance within the body. Prevention is prioritized over simply treating symptoms after they appear. The meridian system and concept of qi flow provide a framework for understanding how energy moves through the body, affecting our physical and emotional health. Traditional Chinese medicine can be used as both a primary therapy and as a complement to conventional medicine. Its herbal formulations and treatments offer a comprehensive approach to healthcare. Diagnostic methods like pulse taking help practitioners assess the body's condition and create personalized treatment plans. By understanding the basic principles of traditional Chinese medicine, you can harness its potential to promote health and achieve optimal well-being. Whether used as a primary or complementary therapy, traditional Chinese medicine can be a powerful tool for achieving optimal health by restoring balance and harmony to body and mind. As we embrace the ancient wisdom of TCM alongside modern medical advances, we gain access to a more complete understanding of health and healing. The principles of balance and harmony represented by the yin and yang continue to offer wisdom for our modern world.